part of the reason that I want to review this article is because, when I'm looking at videos or news or propaganda out of the United States, like from the American Medical Association, Times, PBS, all these propaganda channels, I see a lot of misinformation there, and I see a lot of medical doctors repeating that disinformation, saying, "Oh, melatonin is dangerous," and all that. It's never been proven to be dangerous, but it has been proven to be safe. So when people promote and kind of promulgate and repeat all that propaganda, it just frustrates me. And so I'm trying to counteract some of that medical misinformation against melatonin, which I've done before, but I'm doing it again here because this is yet another example of proving the safety and efficacy of high-dose melatonin. Hope you're all doing well, and I'll see you in the next video. Take care. I'm going to start painting my office next week, or actually this week. Today's only Tuesday, so I'll start painting this place and getting it in shape. Right now it's a bit of a mess, but that's because we just moved here. Hope you're doing well. Take care. Bye.
I have come here to chew bubblegum and kick ass. And I'm all out of bubblegum.
I'm an old soul, got a funky sound. Gonna sing a song, turn the world around.
Good morning, everybody. Dr. Vasquez here, coming to you live to talk about melatonin. So I've obviously talked about melatonin in several other contexts and conversations, but I've been increasingly interested in melatonin lately because I've started using a hell of a lot more of it. Some of you might know that melatonin has some somewhat paradoxical effects on sleep. For example, if you use contrasting like lower doses versus really higher doses. So for example, the physiologic dose of melatonin is about 200 micrograms. So if you take 1 milligram, you're taking 5 times like the normal physiologic production. And obviously you can take it from there. A lot of people take 3 milligrams, seems to work pretty well for a lot of people. At about 6 milligrams to 9 milligrams, we start to see clinical benefits in certain diseases like chronic pain, fibromyalgia, migraine, infectious disease, especially at that dose in neonates. So one of the first studies that came out using melatonin for its clinical benefits against acute sepsis, acute infections in neonates, they used 9 milligrams, and these were just obviously little bitty babies. But that was one of the first studies that kind of compelled me to start using melatonin as part of an antiviral protocol or as immune supporting protocol in patients with whatever type of infection. So I've been doing that for about 25 years. So I think the timing of that is important for a couple different reasons. One is, for example, to express the fact that in naturopathic medical school, I learned about melatonin 26 years ago. Whereas, the medical profession in general acts like melatonin is somehow mysterious and we need more data and they always need more time when it's about anything nutritional, right? So if you look at the medical profession as a whole, they can never understand vitamin D. They can never understand fish oil. They can never understand potassium and magnesium because they always claim that they want and need more time. Oh, and they always say it's because of their high, scientific and clinical standards. Like we wouldn't want to do anything risky in these terminal cancer patients or in patients with infectious disease like COVID. We wouldn't want to do anything risky. Oh, but we'll shut down the entire globe and we'll make people wear face masks that have no evidence or contrary evidence. And we'll make people follow lines on the floor and we'll shut down the gyms, but we'll keep the tobacco stores open along with the alcohol stores. That's somehow scientific. In the medical model, but using melatonin, which is completely safe and has been proven to be effective now for 36 years against cancer, that's somehow considered radical, right? So they always need more time. They always need more time on fish oil, nutrition, vitamin D, magnesium, potassium, CoQ10, whatever else. They always need more time. So they're going to die needing more time, whereas, like I said, I took a course in oncology in naturopathic medical school at Bastyr University, and I took that course in about 1998, maybe 97, under Davis Lamson. Davis Lamson had a master's degree in, I think, biochemistry, possibly pharmacology, but I think it was biochemistry. And he was also a naturopathic medical doctor. And he was our professor for oncology. Because in naturopathic medical school, the expectation is that a person is going to graduate from school with a really wide range of therapeutic options for a very wide range of disease, including cancer and all this kind of stuff. That's why we had courses in cardiology and gynecology and pediatrics and geriatrics and orthopedics and rheumatology. I used to teach orthopedics and rheumatology at Bastyr, at least for 2 years before I relocated. So again, I've wanted to mention that for a while, that, you know, naturopathic medical education is supremely broad, much broader than medical school education these days. I presume, and I don't know, but I presume that maybe medical education was much broader, you know, 30 or 40 years ago. Right now, medical education seems to be centered around doing nothing more than creating hardworking students who will then become residents and just kind of perform in a robotic way. But the actual clinically relevant training of medical school now is really minimal, really minimal. And you can see that in the catalogs of medical schools. Like, I remember looking at a particular medical school one time when I was applying for medical school. This was, you know, what, 12 years ago or whatever, however, 15 years ago. I remember looking at these catalogs of medical schools. I had already graduated from chiropractic and naturopathic medical school, but I was going to go back for another degree. And like their aspiration for their students included things like, we want our students to graduate knowing how to perform a physical exam and how to take blood pressure. And I was thinking to myself, God, that's ridiculous. You know, when we graduated from naturopathic medical school, we were already trained and had clinical experience treating autoimmune disease, eczema, asthma, depression, all types of gut disorders, because we had a class in gastroenterology as well. Not simply studying disease, but actually learning how to treat those things. And yeah, that was, you know, for me, that was 25 years ago, because I graduated in 1999. And obviously the science has advanced tremendously since then. But again, the point is, you know, these things that the medical profession always needs more time in, and they need to think about it more, they need to delay more. I mean, I've been doing some of this stuff for 25 years. And melatonin is an example of that. So back in the day, when Davis Lamson was teaching our oncology course, the doses they were using back then were like 20 or 40 milligrams. So like I said, I've personally started using higher doses on myself lately. And so for that reason, every once in a while, I look at, you know, what's new or what I haven't seen previously. And this is an example of that. So previous studies have used up to 1,000 milligrams in healthy people. They weren't even patients, they were just healthy people. But that was limited to 1 month. They just did a clinical trial. They gave high dose melatonin. Nothing bad happened. Again, with the dosage, the paradox of melatonin dosing for sleep is that some people do really well at 1 milligram, 3 milligrams, but then past 6 milligrams, sometimes people actually sleep not as well with a higher dose. What I have found with myself, and I've seen this in the studies, this study mentions a little bit of that. The paradox again being that low doses for sleep seem to function pretty well. Higher doses seem to have kind of a paradoxical effect that they don't work as well for sleep. But one of the ways to counteract that is to simply dose twice in the night. So for example, like in my case, let's say for whatever reason, I want to take, 40 milligrams or 60 milligrams. Sometimes, either because of that or regardless of that, I'll wake up at like 3 o'clock in the morning and I'll take another 20 milligrams and go back to bed. Usually, at that time, maybe I feel hungry or I want to eat something or get a glass of juice or go to the bathroom or whatever. So pretty commonly, I'll wake up around 1 o'clock or 3 o'clock and I'll take another 20 milligrams of melatonin and go back to bed. Anyway, that's been working very well for me. I haven't noticed any negative effects. I have noticed I feel pretty good, actually. But the only thing I would say that I've noticed that seems to be a clear difference for me in taking personally high dose melatonin, again, high dose might be, let's say 40 milligrams when I go to bed and then another 20 milligrams in the night, so a total of 60 milligrams. The only thing I've noticed from that is that I have absolutely no desire whatsoever to drink alcohol. Not that I had some big desire previously, but sometimes I would have, quite commonly, I used to have like a glass of wine at night or whatever. But since I started taking melatonin a few months ago, higher doses of melatonin, like I don't even have interest in alcohol at all. Like even one glass of wine, like I don't feel like I need it. I don't care about it. I never really cared about it that much. But sometimes, if I had worked late in the night and I was really stimulated, sometimes I would drink a glass of wine just because it makes me sleepy. And obviously I like the taste. So, and I've done other videos on wine and such, so you can look at those. But what I've noticed with taking higher doses of melatonin is like I'm almost repulsed by the idea of drinking wine. Like I don't want it. I certainly don't need it. I never really needed it, but I used to drink it just to go to sleep. And now I just take like 40 milligrams of melatonin and go to sleep. So anyway, with all of that discussion, we're going to look at this article right now. This is the only, it's probably the better example of very high dose, as they state here, very high dose melatonin. And as you can see on the screen, they used 1,000 milligrams per day. Obviously, pretty high dose. I don't really agree with the way that they dosed this, and I'll talk about that. But I'll show you a few highlights from the abstract, and then I'll get into a few details of things that they did very well. This is a decent study. It's just kind of an observational study. Mostly documenting safety and some level of efficacy. These were patients, as you can see from the title, these were patients who had already been treated for cancer. The cancer, conventional medical chemotherapy and whatever else didn't work for them, so their cancer was progressing. And they had already been treated with 100 milligrams per day of melatonin. And so an interesting distinction of this particular study is that when they took these patients from 100 milligrams to 1,000 milligrams, they actually got additional benefit, and that's somewhat to be expected. So melatonin in many conditions demonstrates what we call a dose-response relationship. And so what that means is more the better, especially for something that's low cost and safe. So that's what they demonstrated here. They say, we've known for more than 50 years that the pineal gland secretes certain hormones, the most famous of which, of course, is melatonin, and that melatonin has anti-cancer benefits, completely non-toxic. And again, the anti-cancer activity of melatonin is dose-dependent. So here they used 1,000 milligrams once a day in the evening, about 30 minutes before bedtime. The treatment was well tolerated, no adverse effects, and disease control was achieved in 54% of patients. Again, these were already patients who had so-called failed everything else, which means that the medical treatment itself had failed. So this is a nice review article, in part because of their excellent literature review. So let me just read this to you, and then I'll get back and talk about the doses. I'll review again what they did, and in my opinion, what they should have done, and I'll explain that to you on the basis of pharmacology, not just some random opinion. But this is a really nice sentence, so I'll read this to you. It's a little bit cumbersome, but I'll try to get through it anyway. Melatonin is the only existing molecule in our planet, or on our planet, which is able to counteract the overall 6 major mechanisms responsible for tumor onset and progression. I'll read that one more time. This is a hell of a statement. Melatonin is the only existing molecule on the planet in the known universe to humans, which is able to counteract the 6 major mechanisms responsible for tumor onset and progression, including, number 1, reversal of stress-induced promotion of tumor development. Number 2, inhibition of spontaneous and carcinogen-induced cancer cell transformation. Number 3, contrast of intracellular junction damage. It's a little bit oddly written, just because this is obviously their second language, they're all Italians. But what they mean there in point number 3 here is all of your cells in your body connect with their neighbor through certain proteins, and junction proteins in particular. In cancer, those junction proteins are disrupted. So that's what they're talking about there. Intercellular junction damage, correct. So number 4, inhibition of neoangiogenesis. Number 5, inhibition of cancer cell proliferation. And cancer cells also release immunosuppressive factors, so it retards that. And inhibition of certain tumor markers, etc. I guess they should have said they should have added a 7th component here, which is, very importantly, melatonin interferes with what's called the Warburg phenomenon in cancer cells, and that is their mitochondrial dysfunction, which preferentially shuttles carbon fragments away from metabolism in the mitochondria and into the creation of precursors for cellular proliferation. They should have mentioned that here. That's a sad omission, because this has been known for a long time. Again, cancer cells demonstrate something called the Warburg effect.